Good afternoon, everyone. Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Sébastien Tremblay, and I will be your moderator. Je m'appelle Sébastien Tremblay et je serai le modérateur de ce point de presse. Before we begin, a reminder to place the microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we will be hearing remarks from le Maire, Jim Watson, followed by Councillor Keith Egli, Chair, Ottawa Public Health Board, le conseiller Keith Egli, Président du Conseil de santé d'Ottawa, Anthony Demonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence, and la docteure Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique. Available for questions from the media following the statements we also have. Disponible pour répondre aux questions des médias, nous accueillons aussi Marie-Claude Turcotte, Manager of Immunization at Ottawa Public Health, gestionnaire d'immunisation santé publique Ottawa. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Mayor Jim Watson.
Well, good afternoon, everyone. Bon après-midi tout le monde, and my thanks to everyone for joining us today's media availability. I'm pleased to say that we are continuing to make great progress on our vaccine administration. In total, more than 106,000 vaccines have been administered locally. And this week, we received our largest shipment of vaccines to date, with over 35,000 Pfizer doses arriving. Our staff are working tirelessly to ensure whatever vaccine we get, we are putting into arms as soon as possible. Over the weekend, we completed second dose offerings at all 82 retirement homes in Ottawa. On Monday, all residents aged 75 and older were eligible to begin booking their appointment to receive a COVID-19 vaccine through the province's online booking system or the provincial vaccine booking phone line. Appointments are available at 4 community vaccination clinics, all of which are now open fully: the P and Sportsplex, the Ruddy Family YMYWCA in Orleans, the Eva James Memorial Community Centre in Canada, and here at City Hall in downtown Ottawa. The remaining 3 community clinic sites will be open as soon as the proper supply permits. In addition, on Monday, we announced the opening of pop-up clinics in rural communities. Residents aged 75 or older recipients of chronic care, home care, and who live in a rural community are now eligible to book an appointment for their COVID-19 vaccine at one of the following locations: the Greeley Community Centre, the Navan Memorial Centre, the Osgood Community Centre, the R.J. Kennedy Memorial Centre in Navan, the Richmond Memorial Arena and Community Centre in Richmond, and the West Carleton Community Complex. Eligible residents who live in West Carleton March, Cumberland, Osgood, and Rideau Goulburn wards can call 613-691-5505 to confirm your eligibility and book your appointment. Alors, pour les résidents ruraux, c'est 613-691-5505. Je sais que plusieurs résidents attendent avec impatience une mise à jour sur l'option de recevoir un vaccin dans une pharmacie ou un fournisseur de soins primaires. Earlier today, Councillor Egli and I wrote to Minister Elliott, the Provincial Minister of Health, requesting that Ottawa be urgently prioritized for additional pharmacy locations as the program expands. A significant number of local pharmacies have reached out to us, indicating their willingness to be included in this program. Ottawa, as you know, is geographically unique in its size, and while our community and pop-up clinics have been doing an excellent job in delivering the vaccine, ultimately pharmacies and primary care providers will be key in ensuring the vaccines are available to residents across Ottawa in an equitable fashion. Ottawa has clusters of COVID-19 cases that are comparable to those in the GTA. There is no reason that we can see for us not being included in this program at this time. There is an urgent need in our community for this program, and we ask the province to recognize and prioritize Ottawa as the program rolls out. For those of you who are currently eligible for a vaccine, I recognize that the last few days has not gone as smoothly as we had wanted to due to issues with the provincial booking system. Je reconnais que les derniers jours ne se sont pas déroulés à 100% en raison des problèmes avec le système provincial de réservation. Last Friday, the city identified to the province a significant number of appointments that had been double booked through the provincial booking system. I also know that many of you are having trouble booking second appointments with the provincial system. While we have limited abilities to resolve these issues because they lie solely with the province's booking system, staff have worked quickly to mitigate them and ensure residents have as smooth a process as possible when they arrive at a community vaccine clinic. From speaking with local provincial officials yesterday, I understand that there is a plan in place to fix the issues with appointment bookings, and we will continue to monitor this, of course, very closely. You'll hear further details from Anthony DeMonte on how the city is addressing this matter in the interim. Je tiens à remercier notre personnel de la ville et de santé publique pour leur bon travail ainsi que les résidents pour leur patience. I also want to thank residents for their patience during this process. Just anecdotally, I noticed today when I went down to tour the site here at City Hall, it was running much more smoothly than the previous day. And I really appreciate the hardworking efforts of our staff really pulling together contingency plans as we deal with this issue emanating from Queen's Park. As I mentioned before, this is a huge undertaking, and we're all working together to make it as efficient a process as possible. As you may be aware, Ottawa moved into the red control status in the provincial reopening framework last week. Knowing that this could have a negative impact on local restaurants, some of the hardest hit industries are in fact in the hospitality sector, Councillor Tim Tierney and I, in his role as chair of the Transportation Committee, asked staff to fast track the start of the patio season. Any restaurant or business that had a patio last summer or over the winter are now allowed to set up their patio using the same plan. So far, we have received 107 right-of-way patio and cafe seating applications for the summer 2021 patio season. The patio team has issued 100 permits to date, and we anticipate the remainder will be issued in the coming days. The streamlined online application and circulation process has greatly assisted with the fast tracking of permit issuance. Council has also proactively waived patio fees as part of the 2021 budget. Waiving these fees will save a restaurant an average of $4,500 this year alone. My sincere thanks to staff who have worked hard and quickly on this project, and their efforts are making a difference for our local restaurants, as we saw during the beautiful weather this past weekend. In addition, on Friday, I will be announcing further supports from the city for our small business community, so I ask you to stand by for that announcement on Friday. Tomorrow marks the anniversary of the first COVID-19 death in the city of Ottawa. I'll be hosting an outdoor interfaith service to honor all City of Ottawa residents who have lost their lives to COVID-19. Dr. Etches will join me at the service along with community and faith leaders. Chief Wendy Jocko, Algonquins of Pikwakanagan First Nation, Mr. Francois Couillard, Baha'i Community of Ottawa, Reverend Dr. Anthony Bailey, Parkdale United Church, Rabbi Shir, Congregation Akziki Hadass, and Imam Sami Metwali, Islamic Society of Gloucester. Although provincial restrictions prevent members of the public from attending this service in person, I encourage residents to watch it live on my Facebook page. This time may be difficult for some. I would urge anyone who needs support to please contact the Ottawa Distress Centre's 24/7 phone line at 613-238-3311. That number once again is 613-238-3311. Now I'd like to hand it over to Councillor Keith Egli to share a few words. Merci. Thank you very much, Councillor.
Thank you, Mr. Mayor, and good afternoon to everybody. Bonjour, Quay. Thanks for tuning in today. We are marking 1 year since the first COVID-related death in our city, and I'd like to offer my sympathies to everyone who has been impacted by the sickness or death of a loved one as a result of COVID-19. This has been a very difficult year for everyone in our community. I'd like to thank Ottawa residents for the continued dedication to protecting one another. From wearing masks to physically distancing, rescheduling, or finding new ways to celebrate life events, Ottawa residents have proven time and time again they care about the wellness of their neighbors. While it's good news that we're in the process of vaccinating, it is still vitally important that we continue to practice the actions that have been able to carry us through. Physical distancing, practicing good hand hygiene, and mask wearing all play a role in helping us as a community respond to this virus. This is not over yet. We are still in the process. The vaccination process is a huge help, but we still have work to do, but we will get there. I know we will. We know that some communities are significantly more impacted by COVID and face complex barriers to accessing social and health services and supports. That's why on March the 10th, OPH and partners launched a new community resource for Arabic and Somali-speaking communities. The Ottawa Immigrant COVID-19 Resource Line aims to reduce barriers to accessing information by providing a direct link to Somali or Arabic-speaking intake workers who are trained to respond to the immediate needs of the community and can share information on where to get tested for COVID-19, facilitate access to testing centers, and support them if they test positive and need to find resources on where and how they can self-isolate. The new phone line has been developed in partnership with the Centre for Resilience and Social Development, in collaboration with the Southeast Ottawa Community Health Centre, as part of the Ottawa Health Team, Équipe Santé Ottawa COVID-19 Community Response. The phone number for the resource line is 1-844-833-1234. I repeat, 1-844-833-1234. And more information is available on Ottawa Public Health's website. Additionally, this week, OPH launched a new video in 5 languages called Why Am I Choosing the Vaccine? The video features real residents explaining their personal reasons why they have chosen to get the vaccine. If you have someone in your life who is unsure about taking the vaccine when they are eligible, please do not hesitate to share this video or other OPH information. The video can be found on ottawapublichealth.ca. The content is available in English, French, Somali, Arabic, and Chinese. Yesterday, OPH and the city's accessibility office hosted a very successful forum to discuss vaccination for people with disabilities. OPH is committed to ensuring the vaccine is accessible for all residents. A second forum is planned for April and will be promoted on the city and OPH's social media accounts. I know that booking a vaccination appointment has been challenging and frustrating over the last few days, and there have been glitches on the provincial booking system. And we want to thank each and every one of you for your patience in dealing with this. And I want to also take this opportunity to thank Dr. Etches and Mr. DeMonte's teams for doing everything they can to address the situation, and despite the difficulties to make the vaccination process as smooth and seamless as it possibly can be for our residents. And finally, last Friday, we entered the red control level in the provincial framework. With an increase in transmission, we have to work hard the next few weeks to not enter the next level, or the gray lockdown level. We have been in similar situations before and know what to do. I encourage all of you to enjoy the beautiful weather we've been having lately, but please think of others before making plans. Always wear a mask when interacting with those outside of your household. We can do this. I know we can, Ottawa. Thank you. Merci. Miigwech.
Thank you, Councillor Eglai. We will now hear from remarks from Anthony DeMonte.
Thank you. Good afternoon. Bon après-midi. All residents aged 75 and older are now eligible under the provincial framework to receive a vaccine, nearly a month ahead of schedule. Tous les résidents âgés de 75 ans et plus peuvent désormais recevoir le vaccin selon le cadre provincial, soit presque un mois plus tôt que prévu. Last Monday, the province launched its booking system and customer service desk. While over 41,830 Ottawa residents have booked appointments through the new platforms, it hasn't come without challenges. Daily discussions with the province are ongoing to identify and address issues as quickly as possible so we can continue with our successful rollout of vaccinations. Nous discutons quotidiennement avec le gouvernement provincial afin de cerner et de résoudre les problèmes le plus rapidement possible, de manière à pouvoir poursuivre le déploiement de notre campagne de vaccination. As I indicated last Friday, a data error within the Provincial's booking system resulted in over 3,000 excess appointments at Eva James Memorial Community Center and Ruddy Family YMYWCA on March 23rd, 24th, and 25th. The city doesn't have access to the back end of the provincial system, so the error was not realized by our team until after the bookings were already made. While the province made attempts over the weekend to rebook those that were affected, more than 1,400 residents were unreachable. We know that getting the vaccine into arms as soon as possible is crucial, and we couldn't imagine turning away residents without appointments at the door. Everyone came together to ensure that this didn't happen. The city's Emergency Operations Center and Public Health worked 24/7 through the weekend to develop a contingency plan to make sure that the extra vaccines could be delivered. City staff from across the corporation mobilized to open 2 temporary clinics at François Dupuis Recreational Center and the European Sportsplex curling rink yesterday. Hier, les employés de l'ensemble de l'administration municipale se sont mobilisés pour ouvrir 2 cliniques temporaires au centre récréatif François Dupuis et sur la piste de curling du Sportsplex de Nepean. The team also arranged shuttle buses to transport residents needing to get from one clinic to another. We know the situation wasn't ideal for many residents arriving at the clinic yesterday. There were longer than usual wait times, and some residents had to move locations. However, and most importantly, every resident that showed up for an appointment yesterday received a vaccine. Mais plus important est que chacun des résidents qui se sont présentés à leur rendez-vous hier ont été vaccinés. This brings us to 106,508 doses administered in Ottawa to date. Yesterday alone, we administered 5,588 doses, our highest amount in one day since we began immunization based on vaccine availability. My thanks to the staff for their quick turnaround and hard work to get these clinics set up and for their unwavering commitment to getting needles into the arms of our residents. I'd also like to thank all residents who were understanding and patient at clinic locations, as it allowed our team to pivot and adjust our operations. Je tiens également à remercier tous les clients des cliniques pour la coopération et leur patience qu'ils ont fait preuve, qui nous a permis à notre équipe de réagir rapidement et adapter nos opérations à la situation. We continue to move forward and to make progress with our vaccine rollout. We have completed second dose offers vaccines to residents in all 28 long-term care and 82 retirement homes. We have run 12 different pop-up clinic sites in high priority neighborhoods, and we are now launching 6 additional pop-up sites in our rural communities to help those who might have difficulty making it into the city. We have partnered with Wabeno Center for Aboriginal Health and the Akusavik Inuit Family Health Team to provide vaccines to Indigenous adults. And we continue to offer vaccines in congregate care settings for seniors and shelters. We also continue to work closely with our partners at the Ottawa Hospital and Queensway Carleton Hospital to deliver vaccines to thousands of local healthcare workers. We have faced challenges in recent days, and I'm sure there will be more in the future as we roll out the largest vaccine distribution in our history. But we will continue to adapt and to ensure deliveries of vaccine to our residents. Nous avons été confrontés à des difficultés dans ces certains jours, et je suis certain qu'il y en aura d'autres, étant donné que nous procéderons de la plus importante distribution des vaccins de notre histoire. Néanmoins, nous continuerons à disposer et dispenser des vaccins aux résidents. We started off this week having administered 95% of our available inventory, and we are ready to scale up as we receive more vaccine. Our 4 community clinics, each are operating now with 2 shifts as supply increases. Adding additional capability will continue if we receive more vaccine. We know how important it is to protect our most vulnerable and getting our lives back to some semblance of normal, and we are committed to making this happen. In closing, I'd like to take a moment also to talk about spring flood mitigation. The city is currently working with our partners and stakeholders in monitoring water flows and levels of the Ottawa, Mississippi, Rideau, and South Nation rivers, including their watersheds and tributaries. A reminder to those working at sandbag stations or those making plans to build sandbag walls to protect your property during the spring freshet, to please do so in a COVID-wise way. Nous rappelons à ceux qui travaillent au poste de remplissage de sacs de sable ou à ceux qui prévoient construire les murs de sacs pour protéger leurs propriétés pendant les crues printanières, de faire preuve et respecter les directives de la COVID-19. We have removed shovels from the city's sandbag filling sites as these are considered high touch points. So if you plan to collect sand or sandbags from the locations, we ask you to please bring your own shovels, gloves, and other tools you may require. Please remember to practice physical distancing and stay at least 2 meters away from other residents while on site. Lorsque vous serez sur place, n'oubliez pas de pratiquer la distanciation physique et de maintenir la distance d'au moins 2 mètres entre vous et les autres résidents. Please bring a face mask and wear it anytime physical distancing cannot be maintained. We're encouraging people living in the same household or people in the same immediate family to work together in small teams to respect the current physical distancing measures. And of course, if you're sick or not feeling well, please stay at home. Throughout the spring, residents can find updates about water levels, about sandbag stations at ottawa.ca, or from the city's Facebook group, Spring Flood 2021, Crue Printanière 2021. Thank you very much. Merci beaucoup.
I think it's over to me. I'll be the shortest, probably just to say bonjour, hello, Quay, and to acknowledge that it is 1 year since the first loss of an Ottawa community member to COVID-19. I want to take a moment to think about all the losses that so many have experienced. Because those numbers on the Ottawa Public Health dashboard present people. Their grandparents, mothers, fathers, siblings, aunts, uncles, friends, neighbors, knowledge keepers. They're people we passed on the street and on the bus. Our collective efforts will prevent more loss, as will the vaccinations that are just starting to make a difference for older adults' risk in our community. So, we continue to receive questions about what people who've received a vaccine, just one or both doses, can and should be doing. Those conversations will continue. We'll get more guidance as it comes along. And the reality is that vaccine protection is not immediate. It takes time. We're still learning about how the vaccines prevent further transmission and protect those who've received them in real-world settings. La réalité est que la protection vaccinale n'est pas immédiate. Elle prend du temps et nous apprenons encore comment les vaccins empêchent la transmission et protègent ceux qui les ont reçus dans les situations réelles. 2 doses provides the maximal protection, and most in our community will not have that second dose for a number of months. I know due to limited contact with loved ones this past year, the world has felt very small. Grandparents are excited to hug their children. People want to book their summer holidays. We all want things to get back to normal. We simply aren't ready for that yet. Not quite yet. Soon, but not yet. One of the biggest challenges with COVID-19 is the large percentage of asymptomatic infections, especially in children. The rates in children and youth have climbed over the last couple of weeks. Les taux chez les enfants et les jeunes ont augmenté au cours des dernières semaines. And the number of outbreaks that we're seeing in hospitals, also long-term care homes, retirement homes, it's high. It's causing pressure on a system that is already strained with trying to catch up on needed procedures previously delayed. Le nombre d'éclosions que nous observons dans les hôpitaux est élevé et provoque une pression sur un système déjà mis à rude épreuve pour tenter de rattraper les procédures nécessaires qui ont précédemment été retardées. And the median age of people in hospital is currently 66. That's not an age bracket protected by vaccine yet. So the more we let COVID-19 levels rise in Ottawa now, the less the vaccinations will be able to push the rates down quickly. It's about sticking with the basics for just a little bit longer. It's masks, distance between people outside our household. Il s'agit de s'en tenir aux principes de base pour un peu plus longtemps. Masque, distance entre les personnes extérieures à notre ménage. We're talking months, not years, but also not weeks. I know a lot has been asked of Ottawa residents this last year. Many sacrifices have been made. There is still a lot we can do while remaining COVID-wise, as long as everyone in the household is feeling well. This weather we've been having, I strongly encourage people to spend as much time outdoors as possible. Wear a mask, stay outdoors, and maintain distance if you plan on visiting people outside your household. We can continue to support local businesses by ordering takeout or curbside pickup, going during off-peak hours, or shopping alone. We can eat at a restaurant with members of our household. We can get a haircut. Just be sure to wear a mask and provide your contact information. If we continue to follow public health guidance, we can avoid going into the gray lockdown zone. Things don't have to get worse before they get better. Merci, Miigwech. Thank you.
Thank you, Dr. Etches. I will now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. We'll now start with Kimberly Molina at CBC Ottawa. Kim?
Great. Can you hear me okay?
We sure can. Go ahead.
Perfect. Dr. Etches, last week you mentioned that 25% of hospitalizations are people in their 50s. Today you talked about sort of the median age being 66. We're also seeing, younger age groups in hospital, including 3 people in their 30s as of today. When you see this sort of number of younger age groups, or that median age being about 66, could you address that and what you're seeing in terms of those younger age groups, and what you might expect and how that might change given the variants of concern and how they're rising in the community?
Thank you. So what we're seeing is that the populations protected by immunization are less likely to be hospitalized. That's excellent to see. That's what we anticipated. And I'm pointing out that there are many people in their 50s and in their 60s in hospital because the vaccine isn't yet protecting those populations, and it won't for a while. So my main point is, don't let up our guard yet. Okay? We don't want our friends and our loved ones to be in hospital if they don't have to be. COVID is not harmless infection for many. For a lot of people, it'll feel like a cold and they'll make it through, but we are learning more about the virus all the time. Some people have long-term symptoms. So if we can prevent infections, that's the way to go. We just want to prevent transmission. So that's keeping the distance between people. We've looked at how quickly are the variants transmitting in our community, and it's quite similar to the non-variant varieties of COVID-19 virus right now. We're watching that. The variants are growing in number in our community. I think we're now on the screening test up to about over 340. We'll see that confirmatory testing has to be done, but those are likely really variants of concern. So they're growing in number. That rate of transmission can be higher. We're not seeing that quite yet in Ottawa. So the basics can work, right? We can stop transmission of the variants with distance and with mask wearing. I think we have to take a look at, in younger populations, where are those blind spots? Where are we mixing with people outside of our households in close contact without the precautions? That is what will drive the numbers up.
Sorry, I had to take myself off mute there. Talking about variants of concern, over the past week, we've seen close to a doubling of the number of confirmed and suspected variants of concern. I believe now we're at 366 from 204 last week. How do you expect that to affect the number of cases and also contact tracing, given that some of these are more transmissible? I know that you said you haven't seen sort of necessarily an increase in the number of people getting these variants of concern, or making it sort of more. Sorry, I'm losing my train of thought here. But
No,
anyways, can you just address that? Yeah.
I can hear the concern about the variants growing, and we do share it. We know they can be more transmissible, and the guidance we have from the province is for case and contact management and how we do that. It's the same for variants and non-variants of concern. So we are always trying to identify when someone tests positive for a variant or not, who are the close contacts. And then we're in a period of time right now where we are triaging. So if somebody in a school or a vulnerable population is connected to that person, that is treated as the top priority. In other situations, we're doing notification out to contacts more with an automated message. But we are still reaching out to all people who test positive and providing them with advice about how to isolate and how to stop any ongoing transmission. And again, those basic measures are the same. If people are self-isolating, that will help prevent forward transmission. When we connect with contacts, we ask them if they're a high-risk contact to isolate. That stops further transmission. If they're a low-risk contact, they just need to monitor for symptoms. That's the usual practice for low-risk contacts. And these are the same measures that we're continuing to use.
Can I just follow up on that? So why are we seeing the number of cases in children and youth increasing pretty significantly over the past little bit?
COVID will be transmitted where people come into close contact with each other where there's no mask wearing. And we're seeing that before and after school. We're seeing that at kids' sports, kids' activities, households, childcare. So, the school environment is more structured. There are levels of protection. And one of the things about going to school in person that is required is that people are tested for COVID if they have symptoms. And so we find more COVID in children and youth because they have to screen themselves every day. If they have a symptom, they have to go get tested. So we find COVID in children and youth when it goes up in our community. Right now, we know the rates in our community are higher. We saw that coming with the wastewater had gone up. We predicted it would be followed with testing numbers going up. And when COVID's higher in the community, you'll see more in children and youth. And you'll see more introduced into schools. But so far, the measures in place have allowed us to follow that process when somebody is school-aged and in school. We go through identifying their high-risk contacts, asking them to self-isolate, and so that's the process again that we'll continue to follow.
Thank you for your questions, Kim. We will now move on to Eric O'Brien at City News Ottawa. Eric?
Hi. My first question is for Mr. DeMonte. I wanted to know a little bit more about the 35,000 doses of vaccine that were delivered to Ottawa this week. Is this kind of in link to the double bookings that we've seen this week as well, or could this kind of be the new norm of shipments?
Yeah, thank you for the question. No, so this is these were the predicted shipments that we were getting, and as I indicated, as we start seeing the shipments increase, we're increasing our capacity. So initially, the sites that we had open were doing just one shift. Now we're running double shifts because we're getting more vaccine. And as a matter of fact, our predicted shipments for next week are somewhere in the neighborhood of 44,000. So we get a bit of a heads up from the province because they analyze what they're getting from the feds and then the distribution across Ontario. So as we get our numbers weekly, or like our predicted numbers for the next few weeks, we adjust our operations accordingly. So this wasn't uncommon. It was a significant jump from previous week where we had only gotten 10,000. So we got 38,000, almost 39,000 for this period. So good news. So we were able to increase, and hopefully that continues. As I said, the next couple of weeks, it looks like an increase to 44,000.
Great. Now, it might be too early to ask this question. I might ask it again in a few weeks, but just, you always say that you're offering the vaccine to this age group, offering it to this age group, 75 now. Have there been many people who have refused the vaccine so far?
The booking system, the way it works, people go and book because they want a vaccine. So it's the inverse is difficult to analyze. So I don't think I can really give you a sense of. I think what you're asking me is there seem to be hesitancy in the general population. I think there's analysis and data for that. Maybe Dr. Etches wants to talk, but I would just say, as a layperson, let her give her opinion. I would get and to anyone, get the first vaccine that's made available to you. But I'll turn it over to Dr. Etches, but we don't have a way to measure that necessarily.
What we can do is look at the vaccine uptake by age group as the different ages are offered the vaccine. And so we know people over 90 were first offered the vaccine across the city, and we've passed the target for uptake. We're now over 78% of people over 90. So people have come forward past the threshold we were hoping to cross. And similarly, we are on track for that with people over 80. So we've had no trouble filling the appointments. I think that we're going to see very high coverage in this age group as well by the end of the month.
Thank you, Eric. We will now move on to Josh Pringle at CTV Ottawa. Josh?
Thank you very much. My first question is for Mr. DeMonte. Does the City of Ottawa know just how many people have been unable to book an appointment this week because of the glitches with the online booking system? And has the city seen any improvement in the system over the past 24 hours?
No, we don't really have a way to measure because again, the system is a provincial system, to measure those who haven't been able to register. We have seen some change in the last 12 to 14 hours. There were some changes done by the province overnight, and a significant change. I'm just trying to see if I can get you a number here, a number of residents that significant increase in bookings. So I'll probably be able to get it to you in a minute here. So no, I don't have it on hand right now, but yes, there was a significant change in the number of people, and the booking system has improved, and so people are now able to book.
That's perfect. Thank you very much. My second question is for Dr. Etches. Last week, when the province announced changes to the capacity limit in restaurants, the new rules state that only members of the same household can sit together inside. Your colleague in Eastern Ontario is now suggesting that that should be extended outdoors to patios due to the variants of concern. So we were just wondering, would you support having new rules to just have household members only sitting together at tables on patios in Ottawa?
Short answer is yes, and the reason is because we know that the more opportunity there is for people from different households to be together, where there's close contact and no mask wearing, the more opportunity for transmission of COVID, and we're just not there yet. The day will come when we can increase the number of opportunities where we're in close contact with people outside our household. We miss that, absolutely. It's just not the time. This is not the time to allow COVID to go to higher and higher levels in our community, we want to bring it under control quickly so that when people are protected with vaccine, we've got low levels to manage and we can really carry on with that progress towards a more normal life. So I think at this point, please go out with your members of your household. Do enjoy the outdoors as much as you can. And I think this is a conversation. Maybe we can clarify with the province what the intent is. Maybe it isn't as clear as it could be in the legislation.
Yeah,
and
if
follow-up.
Sorry, Josh, just before your follow-up. So I do have the number. It's in the last 12 hours since the changes have been made, over 4,218 people have now booked in an appointment. So we've seen a complete change, which is very positive.
Thank you. And just a quick follow-up to that, Dr. Etches, would you issue a class 22 order to have household members only sit together, or would that be something you'd approach the province to see about clarifying the rules?
I think we've actually already, the team has already written to our Chief Medical Officer of Health to look for some clarity in terms of what was intended. And if we can accomplish that for the whole province, that's the best way to protect people. But yes, if that isn't a direction that things are going in, then we would be looking at local solutions.
Thank you very much.
Thank you for that. We will now move on to Craig Lord at Global Ottawa. Craig?
Thanks very much. I think this would be for Anthony DeMonte. I believe you said last week or the week before that the Emergency Operations Center has a contingency plan where outages in the provincial booking system, you could step in and hopefully still continue bookings locally at least. Can you give a sense of what would lead you to implement that contingency plan and what it might look like?
Yeah, and I want to repeat, though, I said a contingency plan that wouldn't be as effective, right? It would be a little, and I think I used the word clunky. Yeah, we do have a plan. It would be basically a call center, which would be problematic. And we do have software tools at the city for other programs, but it's really not designed for this type of use. To your question directly, what would make us turn that on is if the provincial system would fail for a significant amount of time, could not be put back up, and that we had vaccine available in Ottawa that would be limiting us putting it in arms. Our main mission, since we said since the beginning, is to get the vaccine into people's arms and to vaccinate people as quickly as possible. So that would be the criteria that would turn things around. We would continue, and the other challenge we would have is it wouldn't be as the specificity of what we could do wouldn't be as good as with the provincial system right now, because it would be a very basic system. You would call and we would just book you through a call center. The priority groups, it would be a little more difficult. We could only go by age and not some of the other priority groups, which are important. So it would be something that we wouldn't take lightly, and we would really analyze before deciding to turn on a municipal or a local tool instead of the provincial tool. So we're not there. There was some glitches. The province reacted and they've adjusted. And as I just told a colleague, the last 12 hours, 4,000 people now have been able to register. So things look positive, and we'll continue to monitor. So we're not there right now.
Great, thanks. And as a follow-up to you, we saw that for health workers, there was a pre-registration system put in place. Do you anticipate that we'll see pre-registrations for other priority groups as they're gearing up towards being opened up to the sequence via the province?
We would hope that for all the other groups that they will be able to go through the provincial system. If there are specific targeted groups, we could look at that. But right now, the healthcare workers are a specific group that do the pre-registration because they're going through another process. So no, we would like to transition everybody into the provincial system.
Thank you very much.
Thank you. On va maintenant à Julien Paquette avec le droit. Julien?
Oui, bonjour. Je ne sais pas si la question s'adresse plus à M. Watson ou à M. DeMonte, mais je voulais revenir sur les cliniques de vaccination dans les zones rurales qui ont été ouvertes aujourd'hui, et aussi à la lettre qui est envoyée concernant la vaccination dans les pharmacies. Si je comprends bien, toutes ces initiatives-là, dans le fond, l'objectif principal, c'est de s'assurer que ce soit le plus facile et le plus le plus simple possible pour les gens de se faire vacciner, peu importe où ils habitent à travers la ville. Si c'est le cas, peut-être juste m'en parler un peu plus longuement de cet objectif.
Ben, peut-être je vais commencer, Julien, et après ça, Tony va ajouter. Certainement, comme tu sais, et tout le monde sait que la ville d'Ottawa avait beaucoup d'espace. C'est presque 2600 kilomètres. Et la raison qu'on a décidé d'utiliser les centres récréatifs dans les quartiers ruraux est parce que c'est probablement plus difficile pour des personnes d'aller ici à l'hôtel de ville si elles habitent à Cumberland ou Osgood ou Fitzroy Harbour. Alors, c'est plus efficace pour les résidents et c'est la même raison que M. Aigla et moi avons écrit une lettre à Mme Elliott pour demander les vaccins à les pharmacies, comme on a vu à Toronto et à Kingston. Encore, il y a beaucoup des pharmacies dans la ville d'Ottawa, plus de 200, et je pense que c'est plus efficace si on suivra la même situation qu'on a vue à Toronto et Kingston pour la deuxième plus grande ville dans la province. Tony?
Non, Monsieur le maire, je n'ai rien à ajouter. Je pense que vous avez bien décrit. Merci.
Parfait. Puis, mon autre question, dans le fond, c'est concernant la vaccination dans ces centres récréatifs en milieu rural. L'enregistrement, est-ce qu'il se fait également à travers le système provincial ou il y a une procédure spéciale comme ça concerne des gens qui habitent dans les quartiers avoisinants?
Tony?
Oui, non, pour ces gens-là, ils ont à communiquer avec le numéro de téléphone de santé publique et non via le système provincial. Le système provincial est pour nos grandes cliniques, mais comme le maire l'a indiqué, puis vous avez dans votre préalable de votre question, on tente de trouver des moyens pour que ce soit le plus facile possible à des gens dans des milieux. Fait qu'on a des gens, les communautés à haut risque, on a fait des processus spéciaux pour eux, encore un numéro spécifique. Et pour le rural, on fait la même chose. Donc, pour ces gens-là, le numéro est le 613-691-5505 via Santé publique. Ils peuvent enregistrer à ce moment-là, pour ces endroits-là, à ce numéro-là.
Merci beaucoup.
Merci. We will now go to Elizabeth Payne at the Ottawa Citizen. Liz?
Thank you. I think this is a question for Dr. Etches. I wanted to follow up further on vaccination rates by age groups. In the city, according to the figures I have, which perhaps have since been updated, so maybe slightly out of date, but Ottawa has vaccinated just over 57% of people over 80 compared to the province, which is about 71%. I don't know if Dr. Etches is there or if somebody else can help me in explaining why is that? What's the difference? Is it something to do with lack of vaccinations, slowness of the rollout? We don't have pharmacies. What are the factors there?
So I'll just take us back to what was a short time ago when the province of Ontario decided to move people who were 80 and above into phase 1. So that was communicated as a decision mid-February, and Ottawa immediately started to plan to be able to vaccinate people over 80. It was for implementation on March 1st that week, and we opened up our clinics to people over 90, first starting over 80 in the highest risk neighborhoods, and then over 90. And then we went to anybody over 80 when the March 15th provincial booking system opened. So we have moved along as quickly as we could to vaccinate that population over 80. The pop-up neighborhood-based sites were first started and the 90-year-olds in a smaller way because we didn't have vaccine supply. We did not have higher quantities of vaccine. And so the differences you're seeing across the province are absolutely connected to how much vaccine did different areas get per capita, per population at risk. There are a larger number of healthcare workers in Ottawa. And so part of, being a major center for all of the Champlain region and beyond is that we have larger hospitals, more staff, more specialists in the community, a greater whole healthcare community that we also had to work through in phase 1. We're still working through and providing that vaccine according to the provincial framework. So the province is the one that is setting out who should be immunized when. They are the ones deciding on allocations, and it's reflecting in our coverage rates. So the point that's very encouraging is that we will be able to reach everybody over 80 by the end of the month. We do believe, looking at the projections of vaccine supply now increasing, and that is on target for what the province is saying we need to do for phase 2 to start at the beginning of April. So phase 2 starting at the beginning of April is when we start to then move down in the age categories, below age 75 and onwards.
Okay, just to follow up on that, is Ottawa getting, how are the doses divided? Is it per capita? Do you feel Ottawa gets less?
I think you need to talk to the province about that.
Okay, all right.
The pharmacy allocations were on top. So Kingston and, a couple others were given greater allocations for pharmacies. So that would show up as a difference. Some primary care pilots were rolled out in other areas. So that would be greater allocation. So really need to ask the province.
Okay. If is that my second question? If it is, I'll stop. If not, I have another one.
I'll give you one more.
Well, yeah, thank you. It is a question, I think, for Mayor Watson. Did you write that letter to the Minister of Health about pharmacies because Ottawa was not scheduled, as far as you know, to be on the list of pharmacies in future rollouts, or why that urgent request right now?
Yeah, thanks, Elizabeth. The reality is that, we looked at the situation and we understand the hotspot being Toronto. It would make some sense to have pharmacies provide the vaccination there. But they also sent it to Kingston, and Kingston, as you know, is got fewer hotspots and fewer counts of COVID, even on a per capita basis, than the city of Ottawa. And our challenge, of course, is geography, as I mentioned to Julien. Our city is 2,600 square kilometers, and we can fit the cities of Toronto, Montreal, Vancouver, Calgary, and Edmonton all within our boundaries. So we need more distribution points because as we start to go down the age scale, there are going to be more and more people signing up for vaccinations. So if we can disseminate those people not just to the big, large centers that we have operational now, but to pharmacists or to their family physician, that's going to take a lot of pressure off of the large scale operations that we have open right now. And so, I think we recognize there's continues to be challenges with supply, but our plea that Councillor Egli and I put in our letter basically indicates that we're the second largest city in the country, or in the province rather, and we have geographic challenges that outweigh any other city really in the province of Ontario. So we're hopeful. We've heard some rumblings that there might be 3 pharmacies dedicated in Ottawa. Well, I guess 3 is better than nothing, but the reality is we need probably dozens of pharmacies in different parts of the city, particularly in the hot zones where there's a higher proportion of COVID-19. We need to help these people much more quickly. And we're
Jim, and if I can just add, we have 21 communities in the hotspot. So to bolster what you said, 3 pharmacies is not going to do it.
Yeah, and I think that's a good point, Keith. I think the other thing, Liz, is there was a story on the news the other day that several thousand people, or several hundred people rather, from Ottawa were going to Kingston. So that's not helpful, bringing people from a red zone to a I don't know where they are, orange or yellow, and that's why I think it makes some sense to bring those doses farther east here to Ottawa.
Okay, and you have heard that 3 pharmacies will get it, or that you said rumblings? What does that mean?
Well, you know, we've talked to some provincial officials who've indicated that there may be an announcement of, you know, a few pharmacies being identified in Ottawa. And, you know, as I said, 3 is better than nothing, but we haven't heard anything formally. These are just back channel discussions we've had with people in the provincial government.
Okay, thanks very much.
Thank you so much. We will now move on to Taylor Blewett at the Ottawa Sun. Taylor?
Thanks so much. Dr. Etches, I'm wondering, what is our wastewater telling you right now about COVID activity in our community?
What we saw after the rapid rise a number of weeks ago, I'm just trying to pull it up, beginning of March, we saw that rapid rise. Then we saw a fluctuating level at a high level. So it was going up and down, but it was still at a level, you know, as high as some of the challenging times we've seen previously with COVID in our community. The last couple of days, it looks like it's decreasing, although we have, again, sort of a fluctuating picture and it's the average that looks like it's going down. So our colleagues who work on this analysis and the wastewater systems are taking a close look at this. They're trying to examine why it's going up and down and fluctuating as much as it is.
Thanks so much. And I'm also wondering, in doing case and contact management, are you seeing at all that people are changing their adherence to public health guidance after getting a vaccine dose?
I'm not aware of that at this point. I don't have any data on that. We can ask the team.
Thanks so much.
All right, thank you, Taylor. Et là, on va à Rémi Autier avec Radio-Canada. Rémi?
Oui, bonjour. Ma première question serait par rapport à justement ce programme de vaccination en pharmacie. Monsieur Watson, vous venez d'en parler de pourquoi on en a besoin et la demande que vous avez faite. J'aimerais peut-être vous entendre en français sur l'importance d'avoir ce programme-là ici et qu'est-ce que vous avez demandé, qu'est-ce que vous avez entendu de la part du gouvernement provincial. Est-ce que ça va arriver ou non? Là?
Oui, certainement. Aujourd'hui, M. Aigla et moi avons écrit une lettre à Madame la ministre Christine Elliott pour demander des options pour des résidents d'utiliser des pharmacies dans tous les quartiers de la ville d'Ottawa parce qu'on avait beaucoup de géographie. Et je pense que c'est efficace d'avoir des pharmacies dans tous les secteurs de la ville d'Ottawa. Ça va aider avec notre système. C'est meilleur pour les résidents qui habitent juste à côté d'une pharmacie. Et il y a beaucoup de pharmacies dans tous les quartiers dans la ville d'Ottawa. On avait des discussions avec des fonctionnaires à Queen's Park et on attend qu'il y ait une possibilité de 3 ou 4 pharmacies pour la ville d'Ottawa dans l'avenir, mais ce n'est pas officiel. Alors ça, c'est la raison qu'on a écrit une lettre officielle pour demander le traitement juste parce qu'il a désigné, je pense, 3 régions pour utiliser le vaccin dans les pharmacies, Toronto, York, je pense, et Kingston. Et nous avons plus des défis ici à Ottawa qu'à Kingston, par exemple. Et la lettre est de demander pour cette option pour les résidents de notre ville, parce que nous sommes la deuxième plus grande ville dans la province de l'Ontario.
Et comme question de suivi, ce sera encore pour vous, M. Watson. Vous aviez envoyé une lettre le 14 mars, le dimanche le 14 mars, disant que vous vouliez ouvrir 7 centres de vaccination en 10 jours, de centres communautaires. Oui, il y a les pop-up, mais il y en a seulement 4 qui sont ouverts. Je comprends que c'est en partie le manque de vaccins, de doses de vaccins disponibles, mais j'aimerais vous entendre, est-ce que c'est un échec, un failure de votre part d'avoir voulu planifier 7 cliniques et que ça n'a pas fonctionné en 10 jours? Et à quoi ressemble le nouveau timeline?
Oui, mais certainement, on a décidé de, par exemple, décider d'aider les communautés rurales avec 4 ou 5 sites en plus que les 4 qu'on a ouverts pendant les dernières 2 semaines. Le problème, comme vous avez dit, il y a un problème au manque de vaccins pour ouvrir les 4 autres sites dans la ville. Si on reçut une grande quantité de vaccins pendant les prochaines semaines, on va ouvrir les autres centres, par exemple, le Parklands Down, c'est un autre. Mais sans vaccin, c'est impossible d'ouvrir un autre centre. Et on continue de travailler avec la province. Cette semaine, on a reçu, je pense, 36 000 doses pour COVID-19. C'est bon, mais on a besoin plus de ça pour ouvrir des autres centres.
Combien il en faudrait, juste savoir, combien il en faudrait par semaine pour ouvrir 7 centres?
Tony, est-ce que vous avez une réponse pour...
Bon, pas une réponse exacte. Notre objectif, puis juste mettre en contexte, c'est loin d'être un échec. Les 7 centres sont prêts à opérer, comme le maire avait dit. Les 7 centres sont actuellement prêts à opérer. On n'a pas le vaccin. Même quand on a ouvert nos 4, on n'avait tellement pas de vaccin, on pouvait avoir seulement un quart de travail. Maintenant, on travaille avec 2 quarts de travail, parce qu'on a plus de vaccins. L'objectif ultime, c'est d'avoir, chacun de ces centres-là devrait être en mesure de par jour, avoir 2000 personnes qui passent à travers les centres, mais on est loin de ça pour les 7 centres. Fait que c'est vraiment relié au vaccin et on n'a pas le nombre de vaccins nécessaires pour ouvrir les centres. On aurait des centres ouverts avec le personnel, les gens viendraient, puis on n'aurait pas de vaccin à leur donner. Donc, c'est ça vraiment qui fait en sorte qu'on rouvre ou on rouvre pas un centre.
Merci à vous deux.
Et merci tout le monde. This is all the time we have today. C'est tout le temps que nous disposons aujourd'hui. Thank you. Merci.